Just a few words, moments. So the term is anthracosis. Anthracosis, that's accumulation of coal dust. In which case it can happen? In which case it can happen? That's right. So sometimes, of course, that's because of the job, because of work at the mines and others. But the most popular is smoke. And so after the test, we will look for several micros and all the. Okay, maybe not all, but almost all the ones that we have at micro, you will see black spots. That's anthracosis. Just in case, everything black spots you see, that's anthracosis. That's coal dust. So usually we don't see black ones at all. So that's anthracosis. Okay, you have to know 6 terms like hemosiderin, ferritin, bilirubin that we have in normal, and hematidine, hematin, and porphyrins that we have in pathology. About hemosiderosis. Hemosiderosis happens because of the hemolysis. Hemolysis, so that's decay or destroying of the erythrocytes. There are 2 types of hemosiderosis: general and local. General because of some hemolysis, because of some toxins, some problems in the spleen and others. So why it goes general or systemic or intravascular? Because it happens in the vessels. So there is destroying of the erythrocytes and hemosiderin spreads all over the body and we get general hemosiderosis. What you have to know different is a different term is hemochromatosis. Hemochromatosis, that's when there is too much intake of the iron. This can be primary and secondary. Secondary usually because of the mistake. So when the doctors heal the iron insufficiency anemia and give too much iron, now we see secondary hemochromatosis. It leads to liver cirrhosis, diabetes mellitus, and bronze skin coloration. That's called bronze diabetes. So iron goes to the pancreas, destroys the islands of Langerhans, destroys the pancreas, and the person gets diabetes. And because of the iron accumulation of the skin is bronze, it calls bronze diabetes. Okay, that's liver. And so again, about hemosiderosis. So hemosiderosis, again, if there is hemolysis and destroying of the erythrocyte in the vessels, that's systemic or general hemosiderosis because the hemosiderin spreads all over the body. Local is just simple hemorrhages or traumas, hematomas. So after some heat, there is destroying of the vessels and erythrocytes go to round tissues and erythrocyte die in round tissues. And in this case, that's local hemosiderosis. That's example, that's cerebral hemorrhage. That's brown, as a form of hemosiderosis, brown induration of the lungs. You can see here, and there is specific stain, Pearl's reaction. Another name is Prussian blue, because there's very hemosiderin colors with a very bluish stain. Hemosiderin. Also about hemosiderin, you have to know this word as siderophage. So hemosiderin is non-typical. Usually we don't have hemosiderin in tissue. So we need to delete this somehow. Macrophage took the same hemosiderin. And so macrophage with the hemosiderin inside, as kind of brown macrophage, called siderophage. So macrophage with hemosiderin called siderophage. About bilirubin metabolism, that's jaundice. You have to know such a jaundice, right? From the biochemistry and other disciplines, there are 3 types. That's over HEPAR, and below the HEPAR or mechanical or obturation, right? I suppose we have to know the jaundice, right? Okay. That's the hand is hand of the doctor, and the skin is the person with the jaundice. That's the change in color of the liver and kidney in jaundice. Biliary cirrhosis. So cholestasis, there is the stone in the biliary tract, and bile can go down, goes upper to the liver, and destroys the hepatocyte and leads to biliary cirrhosis. Hematins, that's oxidized form of hem. So when there is destroy of the erythrocytes, there is oxyhemoglobin and hydrolysis of oxyhemoglobin, and we get hematin. For example, that's acid hematin, because in the there is gastritis with erosion, with a little bleeding, and as there is bleeding erythrocytes go in the gastro, destroy, and we get oxyhemoglobin, and that's connection with the oxygen and connection with the acids in the gastro. We have
hydrochloric.
Yes, hydrochloric acid. So, and that's connection, and we see formation of hydrochloric hematine. So that can be, for example, if we use fibrogastroduodenoscopy, so there is specific thing that we put into the gastro and we see such a black spot, that means that it was bleeding. So we see hydrochloric acid hematine. About porphyrias, I suppose you have to remember from the biochemistry,
Porphyria,
right?
yes.
Porphyrias with 3D, that's dermatitis, dementia, and diarrhea. That's how the
Porphyria, red color.
looks like. Actually, that's very interesting opinion. So imagine such a patient. That's a patient with the pale white skin. He avoids the sun because of the porphyrins in the skin. If there is connection with the sun, that's very painful for them, right? So that's and connection with the sun. Dermatitis. And because of the intoxication, there is dementia. So there is very strange behavior. They may be aggressive. They may, without any reason, kill someone. And there is an interesting opinion that's a person with the porphyria. That's the beginning of the legends of the vampires.
Vampires. Oh.
Okay, now what else? Oh, yes, about Wilson Canavale. That's it. About Wilson Canavale. So Wilson Canavale, that's disease. That's genetical disease. So you can only born with this disease. That's insufficiency of the protein ceruloplasmin. Ceruloplasmin, the specific protein that holds the copper in the blood flow. If there is lack of ceruloplasmin and patients with the disease of Wilson-Canavale, they don't have any ceruloplasmin, the copper goes to other organs and damage them. In this case, you see such round, right? That's brown and yellow round, kind of this. That's Kaiser-Fleischer rings. That's specific for the Wilson-Canavale disease. For the eyes, that's not dangerous, because that's just another pigmentation of the iris, and eyes are working okay. So for the eyes, that's not dangerous. The problem is that another name for the Wilson-Canavale disease is hepatocerebral dystrophy. So copper is very toxic for the liver and for the brain. It goes in the liver, goes in the brain, causes cirrhosis, causes dementia.
Dementia.
We have to, so not we, ophthalmologists have to see such Kaiser-Fleischer rings starting from the newborn child. And several years ago, it was not a very good story when it was a kid and ophthalmologists didn't see. It was Kaiser-Fleischer rings. Sometimes that's impossible to see without any specific things. So you need specific light with specific angle to see Kaiser-Fleischer rings. But ophthalmologists can, and they actually must see this. And ophthalmologists at the clinic didn't see. It was newborn, so no any pathology. And at the 5 years, the parents saw that something strange with the kid, and it was dementia, very hard dementia, because when he was 12, his behavior was something like 3 years old child, and he was 12. So that's very hard dementia. He didn't go to school, he didn't understand, he didn't even talk. He was, so 12, he didn't even talk, so absolute dementia. And when he was more than 12, he was, well, in the area he was 12 or 13, kind of this, he became yellow, just yellow. The parents went with him to the doctor to check the liver, and the liver with huge and with total cirrhosis, so liver was almost dying, actually liver was dying, and it was just a few weeks before he becomes dead. The doctors tried to understand why it happens, and they saw that in the analysis of the Cooper is much more higher than in normal way. And then it was genetical test, and the disease was Wilson-Canavale. And of course he has Kaiser-Fleischer rings in the eyes. And the kid died because he didn't live before the transplantation of the liver. He died because of liver insufficiency. And the most tragic moment is that for now that's not lethal disease. For now that's not even very dangerous disease because we have therapy. So starting with the first days of life, we put specific proteins instead of ceruloplasmin. Actually, we put recombinant, the same ceruloplasmin, in the blood flow. Ceruloplasmin, so that's synthesis ceruloplasmin, take the copper and there is no intoxication. And this kit, so it won't be Kaiser-Fleischer-Rings and it won't be damage to the liver and won't be damage to the brain. That's the most important. So that means that the kids with the recent convalescent disease or hepatocerebral dystrophy, they can live as a normal kids. So go to school, then go to work, have a job, family. So the life is very okay if they have the therapy starting with the first days. And starting with the first days, that's why ophthalmologists always check the eyes and try to find Kaiser-Fleischer-Rings, because that's the first sign of the disease of recent convalescent. That's it. So, and that's it. So that's the most important. Other things, I suppose you can just read and remember. Do you have any questions? Okay. If you don't have any questions, you can be free.
What is the player in the
Huh?
necrosis?